The positive rate of COVID-19 tests creeping up in Alabama, and Mobile County now categorized as very high.
Yeah, this all coming as the pace of vaccinations is slowing. Fox News investigative reporter Brendan Kirby has been digging into the numbers. He now joins us live. And Brendan, local health leaders aren't pushing the panic button just yet.
No, they're not, Byron and Lenise. These are numbers that health experts monitor for signs of a new surge. But despite that very high-risk designation, the risk is still lower than it's been in the recent past. The Alabama Department of Public Health bases its risk indicator on trends, not overall numbers. Mobile County is considered very high risk because cases are up over the past 14 days. That means a county might be considered at low risk if the numbers are going down, even if they are coming down from a high point. Overall, Mobile County's daily infection rate is much lower than it's been for most of the pandemic. Dr. Scott Shavers, head of the COVID-19 response for the Mobile County Health Department, says not to blow the numbers out of proportion.
Any small little change in those numbers percentage-wise can take us from the low risk indices to the very high risk quickly, because it's based on a percentage change. And so please treat those numbers with caution. We are still overall doing very, very well.
Still, infections have trended a bit higher in Mobile County, even as they have continued to decline in Baldwin and other surrounding counties. Alabama State Health Officer Dr. Scott Harris is at a loss to explain why.
I don't have any particular, event or outbreak or, concrete reason that would explain it. I think, one thing we really learned about this disease is that there's a lot we don't know about this disease. It's never been this, giant deluge that's flooded the whole state at once, except for, maybe the holiday season in December.
Dr. Harris says his agency also is closely monitoring the percentage of COVID-19 tests coming back positive. That number has crept back up over 5%, a red flag. But he notes it's still lower than it's been for most of the pandemic. Other trends are positive as well. Overall daily infections have held steady since coming off the Christmas time surge. Hospitalizations are far below the peak and have stayed under the 500 mark for most of the past 2 months. But Dr. Shavers says with slight upticks in the numbers, it's important not to get complacent.
What's concerning there is that when you're in a plateau, you're kind of at a steady state, and you really want to see those numbers to continue to go down. And they have started to go back up a little bit. And that's not only for COVID, but also for influenza.
Dr. Shavers says he's not sure if this recent uptick has to do with the relaxation of the mask mandate or perhaps the effects of spring break. But both he and Dr. Harris say that it's important to increase the vaccination rate in order to have an impact on the infection rate. Currently, some 1.1 million Alabamians have been fully vaccinated. Reporting live in Mobile, Brendan Kirby, Fox 10 News.